And I think there's a real place for digital in bipolar management.
Mm,
I'm wearing Fitbit,
right.
which judges me perennially. um, and I think there's a real space for technology in terms of monitoring the activity of a bipolar person. Because if I am going into a manic episode, I will become more active. I will become physically more active. I will sleep less.
Yeah.
Um, and these are all things that could be picked up by technology.
Yes.
Um, so I could be, I don't even notice I'm wearing this anymore. But it does, it tracks my sleep, and I can wake up in the morning and say like, oh, you got 14% deep sleep last night, Elaine. That's great. Well done. Um, it would be an early warning system for me if I had a wearable device or whatever monitoring my activity, and reporting that not just to me but to my healthcare professionals as well, because the likelihood of somebody self-reporting the beginning of a manic episode is pretty low. I'm getting really good at it now. So if I had more evidence at my disposal of, here, look at my metrics. I've been sleeping for 3 hours a night for 2 weeks. These are tangible. I've been walking 7 miles a day for the last however long, because I get really into exercise when I'm manic, which is, it feels so good when it happens, but it's so bad for you in the long term.
Yeah.
Um, but if I had access to metrics that were being picked up about my behavior in the run up to an episode, I would have more evidence to say to people like, right, listen to me. I'm actually going to go off the handle very, very soon. And if we don't catch it now, we're not going to catch it. And I'm going to end up in a manic episode.